Okay, so it's in chapter 1, and it's just a few pages. It's page 10 to page 20, and it's part of our slows. And so we're just going to talk a little bit about this. I would strongly suggest that if you have some availability, have you talked about all of the, what am I trying to say? The ethical practices like maleficence, beneficence, negligence, all those things. Have you had some exposure to that? So just kind of review that because that'll factor into what we're talking about a little bit. I never tend to think of all of them, but anyway. So we're talking about ethical perspectives. And so sometimes in the field of maternity, maternal newborn, you're going to be confronted with ethical issues of your own, okay? There's some people that work in the NICU that think that keeping a certain baby alive is futile, that they should stop. And so that becomes an ethical dilemma for you to take care of that child. Would you agree? Would it present some ethical issues if you had to keep taking care of a baby that you felt it was silly or futile to keep doing this for this child? Would that be difficult for you? Maybe you would do your care, you would take good care of the baby, but inside you might be fighting a little bit of a personal issue because in your mind you're like, this child's never going to survive. If they do, they're going to have multiple problems all their life, the expense. You see where some people could have problems with that. And so sometimes, and even in a med surg area, somebody's a full code and you're like, why? They're 90 years old and the first time we jump on their chest, we're going to crack some ribs and lacerate a lung or whatever. And you're like, why is this person a full code? That's not our decision, but it does affect how we feel and how we conduct ourselves. Always be a professional, obviously, and give the best care you can. But sometimes those things are hard. What if you're a firm believer, you do not believe in abortion at all for any reasons? Okay? And then you work in a hospital and they say, we're floating you down to the outpatient area and there's a lady scheduled for an elective abortion. What would you do? Not take that patient? That's what they say, you have to or you'll lose your job. Ooh. Huh? Say bye. Well, I don't know. So I'm not trying to make you say what yes or no or whatever. I'm just pointing this out to you that you could run into these situations depending on your own personal values. Again, this is why you need to think about these things before you get in those situations. Because, I don't believe in abortion. But at the same time, I would not mistreat someone who is having one. I would not be hateful and scold them or whatever. I would try to do my best to take care of them. It would be difficult for me. Be very, very difficult for me. And I would ask to be reassigned if at all possible. If it's not possible, then you have to, remember your duty is to care for the patient regardless of their decision. It's just like homeless people. You've had women in OB that smoked meth while they were pregnant. And the baby came out less than perfect, okay? And I've heard some of you say, it made you angry. Made you angry that the mother did that. It makes me angry too. But we can't let that make us treat her worse, okay? We don't know where she's coming from. We don't know what kind of stuff she's gone through. I don't. I'm not going to pretend I do. I've never been drunk. But I can't mistreat a drunkard, because it hasn't happened to me. So those are things we have to think about. So there's ethics and bioethics, what is normally right and reasonable. Bioethics, of course, is about healthcare. Ethical dilemmas, as you see here, there's no solution that seems satisfactory, and that's the bad part. We can't always come to a great consensus of opinion. Okay, that's why we have ethics committees at the hospital. Sometimes patients, their family won't let us pull the plug, so to speak. And we know that this happened to me one time. I was in the ICU and we were taking care of this old patient, and his little wife would not let us stop. And his feet were literally decaying. He was dead, but his feet were decaying and he smelled terrible. It was awful. But she wouldn't come in and see him. She just stood at the door. Well, one day the charge nurse almost dragged her. Now, I don't necessarily agree with this behavior, but it got the point across. She dragged her into the room and pushed her right up to the bed and made her smell him. And she said, this is what we have to take care of every day. And then she made her decision that, he really was dead. So, that's a pretty unusual situation, but it can happen. And that's why when a nurse feels like this is not in the best interest of the patient, they're suffering more maybe. Maybe the family's suffering more because they can't make up their mind. That's when you call in your ethics committee and get some help, because you can't do it all by yourself. You need help. So those are things that could come up in your practice or even as a student maybe. And then there's protocols, there's different things you can do as far as making ethical decisions. And again, this is something that you need to think about before you get in that situation. Okay, here's your ethical principles. You may have heard of these already. Beneficence, non-maleficence, autonomy, justice. There's all kinds of them. Okay, one of the things that you're going to hear a lot about, and you've been hearing about it, the nurse. What was her name at Vanderbilt? What's her name?
Raimondo, whatever.
Yeah, that lady. She made a tremendous med error. Okay. And, they've raked her over the coals and they've put her down. And then there's another group that's like, no, she was fine. You can see the two factions, the two sides of this situation. Okay. Yes, she made a mistake. She owned up to it. That's the first part. If you make a mistake, don't try to hide it, because you won't do yourself or your patient any good. But then the hospital didn't want to talk about it and swept it under the rug. And then she took the blame, which is not right. Okay. 15, I think. For 30 years, she finally got caught. Going back and forth from Canada to the United States. Yeah. And they said she's probably going to get 5 years. Yeah, I think this lady got way too much, but that's just me. But these are things that are going to come up, and you need to decide how you feel and decide what works best for you. Because sometimes it's not cut and dried. It's not black and white. Okay? It's a dilemma. That's why we call them dilemmas. All right? So reproduction, and we're going to talk about ethical concerns in reproduction, and we've talked about that already a little bit, about elective abortions or elective termination of pregnancy before 20 weeks. Now, there's all kinds of things going on now where they have partial birth abortion, where the baby is carried full term and then they crush the poor child's skull and deliver it. Or they stick something in the back of its neck and sever its spinal cord. I personally find that very, very difficult to deal with. I would not be a part of that. I would not. So again, it's something you have to decide. Before 20 weeks is one thing, but carrying the child full term and then essentially killing it is mind-boggling. But anyway, so Roe versus Wade many, many years ago said that having an elective abortion was legal. You could do that because prior to that, women did all kinds of things to abort an unwanted pregnancy, and they were not safe methods. Okay, now these methods are deemed safe, although anything, as you know, any surgical procedure has risks and benefits. Okay, and there is a risk to having an elective abortion, just like any other surgical procedure. And so there's a belief that induced abortions is a private choice, and then there's some that say it's taking a life, that life begins at conception. There's all kinds of different schools of thought, and everybody's going to have their own feelings about it. Our job is to know our own feelings, be as supportive of our patients as we can, give accurate information, and then the rest of it, I don't believe in burning down abortion clinics. I don't believe in that. I don't think that solves the problem. If you want to pick it, that's one thing, but you have to know these things ahead of time so that you know what you're going to do and how you're going to feel about it. Okay, and then sometimes abortions, end up really bad. The baby gets injured but lives, and it's a mess. But anyway, child health nursing, stopping treatment. You got some little guy that's CP, and they've been born encephalic. Part of their brain is not there, and you're like, what do we do with this child? And there's all kinds of ethical concerns in this. And then terminating life support. There's always that thing of quality of life versus life. Some people, I do not want to be resuscitated. If I cannot be resuscitated and have a decent quality of life, I don't want to. That's my own personal feeling, okay? Some people want everything done, pull out all the stops because they don't want to die. I get that. I don't want to die. That's not my wish, but I don't want to live with a feeding tube and a trach and not know who anybody is. And if I can't talk, now you all know I will be in bad shape, okay? Or sing. If I can't talk or sing, just let me go because my life is over. Or drink coffee. There you go. All right. So these are things that will concern you, especially as you get out into practice on your own. There's legal issues, of course, we know all about nurse practice acts. Every state has their own. And you will be judged on your behavior if you're brought before a court. If they say you're negligent, they're talking about what would a nurse of similar education, background, and experience, what would that nurse do versus what you did or did not do? It's called negligence. You could be negligent. You could cause harm and all kinds of things there. We know about standards of care. They're a part of what we do, part of evidence-based practice. There's standards of care we must follow. If you deviate from those standards of care, you could be held liable for anything that happens because you went out on that limb by yourself. Hospital policies, again, if you have policies in place and you follow your policy and something bad happens, they're going to have to do really a lot of bad stuff to catch you because you followed all the steps that you should have. And of course, being accountability and integrity and responsibility, all those go together as a prudent, competent nurse, professional nurse. All right. Knowledge of the current laws. Not to say I just didn't know. I hadn't heard about that. That's not a good excuse. Okay. I'm not saying you comb the paper every day or the Google or whatever for new laws, but your hospital and your nursing organizations like Oklahoma Nursing Association and Critical Care Nurse Association and Maternal Child, all those, if you keep up with those things, then they'll let you know all that stuff and you won't have to go searching for it. And of course, you need to remain competent throughout your nursing career, okay? Right now, if I was to go work on the floor, I would probably have to have a little refresher course in starting IVs because I haven't put one in for a long time. I would not want to try. I would not feel confident and competent. I need a refresher, okay? Now, heart sounds, lung sounds, EKG, they're there. They're still there. But there's something about an IV, I would have to go get a refresher. That's my way of being competent, okay? So you just can't say, well, I graduated from NEO college, and so therefore I'm competent in 2023. What about 2025? Are you still competent? Have you kept up? So that's our job as nurses. And it becomes a legal issue if we're not competent, we try to do something we shouldn't, then we get in trouble. Malpractice, you can be sued, okay? And I'll tell you this right now, those of you who think about working in maternal newborn, that's one of the areas that gets sued the most. Because the baby is born with a birth injury and they want to sue somebody because it happened. And it can happen as a result of poor practice, or it can just happen because the child was born with that issue, okay? So it is something that happens a lot in those areas. ERs are also another big one, okay? So you can be sued. What's the best way to keep from being sued? No practice? Document everything. Document what you did. Remember, if it wasn't documented, it didn't happen, okay? I got subpoenaed one time in a case, and they subpoenaed the record, and they were looking over the records, and I did not have to go to court because my documentation was so specific. I did not have to go. My documentation saved me from having to do that. So if you document what you did, something as simple as you educated the patient on how to push the call bell and not get up and fall. Would that be important to document? Absolutely. If you got somebody at risk for falls and you documented that you educated them, that you showed them how to do it, and you cautioned them not to get up without help, and they get up and fall, it's kind of on them. I mean, you did what you were supposed to do. You followed your policy. You followed competent nurse practice, okay? Informed consent, who's the most important person in that process? Informed consent, whose job is it? The doctor. The doctor is to explain the procedure in a way the patient understands. It's not the nurse's job, okay? If the patient doesn't want to sign it or they get ready to sign it, I got questions and the doc's about ready to go to the golf course. What do? You got to call him. And is he going to get mad? Probably. He'll get over it. You got to do what's right for the patient. Then, if they sign it and they get explained and then you go away in a couple hours, they go, now, what's he going to do again? You can reinforce what was taught. That's okay. And you can witness their signature. When they sign it, you're not saying, I gave the consent. You're witnessing their signature. Lots of times I'll put my name and I'll say to signature only. That's what I do. Let's see. Refusal of care. Can patients refuse to be cared for? Yeah. And lots of times if they won't do everything that we feel is necessary for their care, and they refuse and they refuse and they refuse, you need to call somebody and say, we can't effectively take care of this patient. He needs to be talked to or he needs to go home. I mean, that's true, because we can't do things against people's wishes. We can't force them, okay? All right, adoption, okay? There's a lot of things that go into adoption. They don't make it easy for people, unfortunately. It's costly, takes a long time, but it is an option for people who have decided they can't really have a child of their own, they want to adopt. So there's a lot of legal issues, termination of rights of the other parent. There's all kinds of things that go into it, but it does happen. Okay, when you document, we've already talked about that. The nurse is an advocate, we know about that, and of course we know to maintain our own practice expertise. Questions about ethical issues or legal issues. Just remember, document what you did. Don't document with the thought in mind, I'm going to get sued, but document. Okay, those of you who would like